Welcome to Ulosca channel. Access all nursing practice questions. Clinical nursing fundamental practice questions with answers.
Question 1. What is the first step in the nursing process? A. Diagnosis. B. Assessment. C. Evaluation. D. Planning. Which one is the correct answer? The correct answer is B. Assessment. Explanation. The nursing process begins with assessment, where the nurse gathers information about the patient's physical, psychological, sociocultural, and spiritual health. This forms the foundation for identifying problems and planning care. Question 2. Which device is used to check oxygen levels? A. Glucometer. B. Thermometer. C. Pulse oximeter. D. Sphygmomanometer. Which one is the correct answer? The correct answer is C. Pulse oximeter. Explanation. A pulse oximeter is a non-invasive device placed on a patient's finger to measure the oxygen saturation level of the blood, which is essential in monitoring respiratory function. Question 3. The normal range for adult body temperature is A. 35.0, 36.0 degrees Celsius. B. 36.5, 37.5 degrees Celsius. C. 37.5, 38.5 degrees Celsius. D. 38.0, 39.0 degrees Celsius. Which one is the correct answer? The correct answer is B. 36.5, 37.5 degrees Celsius. Explanation. The normal body temperature for a healthy adult usually falls between 36.5 degrees Celsius and 37.5 degrees Celsius. Deviations may indicate fever, infection, or hypothermia, depending on whether the temperature is high or low. Question 4. Which position is used for rectal examination? A. Supine position. B. Fowler's position. C. Sims position. D. Lithotomy position. Which one is the correct answer? The correct answer is C. Sims position. Explanation. The Sims position involves lying on the left side with the right knee flexed. This position exposes the rectal area for procedures like enemas and rectal exams and is comfortable for the patient. Question 5. What is the most important reason for hand washing? A. To remove sweat. B. To prevent infections. C. To avoid stains. D. To cool the body. Which one is the correct answer? The correct answer is B. To prevent infections. Explanation. Hand washing is the most effective way to reduce the spread of germs and infections in clinical settings. It protects both patients and healthcare providers from healthcare-associated infections. Question 6. What is the best site for checking an unconscious patient's pulse? A. Radial artery. B. Popliteal artery. C. Carotid artery. D. Brachial artery. Which one is the correct answer? The correct answer is C. Carotid artery. Explanation. The carotid artery, located in the neck, is the preferred site for checking the pulse in unconscious or critically ill patients because it provides a strong and easily accessible pulse. Question 7. What does PRN mean on a medication chart? A. Before food. B. Every hour. C. As needed. D. After meals. Which one is the correct answer? The correct answer is C. As needed. Explanation. PRN is an abbreviation for the Latin term pro re nata, meaning as needed. It indicates that the medication should be given when necessary, based on symptoms or patient requests. Question 8. Which sign indicates dehydration? A. High blood pressure. B. Moist skin. C. Sunken eyes. D. Warm hands. Which one is the correct answer? The correct answer is C. Sunken eyes. Explanation. Dehydration reduces fluid in body tissues, often causing sunken eyes, dry mouth, low urine output, and poor skin turgor. It's a critical condition requiring prompt fluid replacement. Question 9. Which of the following is a sterile procedure? A. Blood pressure check. B. Oral medication. C. Catheter insertion. D. Bed bathing. Which one is the correct answer? The correct answer is C. Catheter insertion. Explanation. Catheter insertion requires sterile technique to prevent introducing bacteria into the bladder, which could lead to urinary tract infections. All equipment and hands must be sterile. Question 10. Which nutrient helps in wound healing? A. Vitamin D. B. Iron salt. C. Vitamin C. D. Calcium powder. Which one is the correct answer? The correct answer is C. Vitamin C. Explanation. Vitamin C is essential for collagen formation, which supports tissue repair and wound healing. It also enhances immune function, reducing the risk of wound infections.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.